Hey everyone, welcome back. Let's discuss some pearls for leaky gut. In doing this for a while, you pick up a few tips and tricks and hopefully have some wisdom that you can share. And if I can share that to help you along your path, then obviously that's a huge win. The first thing I'd want to share with you, make you aware of regarding a pearl for leaky gut would be determining your gut type. I think of this as there being three different gut types: bacterial, fungal, and immune. Now, regarding a bacterial type gut, this is your classic SIBO, small intestinal bacterial overgrowth, IBS type individual. And they'll notice that especially higher fiber, lots of vegetables tends to flare them. And these are the people who will say, the better I eat, the worse I feel. I thought I was doing so good. I had a big salad. I had a bunch of broccoli, whatever it is, right? Your typical sort of diet dictates lots of fruits and vegetables tend to flare these people. This is because there's either an overgrowth of bacteria, and some of this is actually changing in terms of the underlying thinking. I'll come back to that with one of our subsequent pearls. Or it could be a disruption between the gut and the brain. But irrespective of how we define it, what you do to improve it stays the same. One of the things that you can do to improve it, given, if this is a bacterial type gut, would be a low FODMAP diet. And a low FODMAP diet is by design going to reduce the amount of prebiotics, the substrate that feeds bacteria. And the most important thing here is that low FODMAP diet clinical trials have shown impressive efficacy, not only for rectifying the symptoms that are very troublesome, obviously, gas, bloating, abdominal pain, loose bowels, but also to reduce leaky gut, to be pro-motility, to rectify dysbiosis, or to lower gas levels. So this is the one gut type, the bacterial type. What's interesting is that the fungal type is sort of the mirror opposite. The fungal types will generally do well on this higher vegetable, higher fiber sort of diet. They may gravitate toward a paleo diet, let's say, and they thrive on that, whereas the bacterial types won't. Now, here's an interesting sort of connection. If you've ever done a SIBO breath test, some people will remark, I felt great when I was doing the preparation diet for the test, which is essentially white rice and meat. That's the bacterial type. They may do well on that sort of higher starch diet. This will flare the fungal types. And this is because fungus feed on starches and simple sugars like sugary fruits. So think white rice, white potato, bananas, mangoes. These are not good for fungal types. However, they do well on, again, sort of your lower carb paleo sort of approach where they're eating salads and broccoli and asparagus, berries, but they're wary of things like white rice, white potato, breads, especially white breads, even if they're gluten-free, and higher sugar fruits. Hopefully this gives you some attunements and there's a few light bulbs going on in terms of if you have a bacterial type gut and you eat foods that feed bacteria, you'll oftentimes provocate your symptoms. And conversely, if you have a fungal type gut or candida and you eat foods that feed the candida, higher starch, higher sugar, you will likely flare your gut. Just as one data point here, we have discussed this on the show in the past to sort of add to the data regarding the randomized clinical trials for the low FODMAP. What about a candida diet? Well, one study found that compared to nystatin, antifungal medication alone, if you paired that with diet, you literally doubled the efficacy of candida clearance from 42% to 85%. So diet plays a big, big part of this picture, whether it's bacterial or it's fungal. And by the way, if this has been helpful, please comment, subscribe, and if you wouldn't mind, share this with one person that you think it may help. This does so much to allow us to reach and get helpful information in front of more people, so I would really appreciate that. Okay, so let me come to the immune type. Think bacteria and fungus on one layer. And underneath that, for some people, can be another layer of the immune system. These individuals tend to have symptoms as follows. They're a little bit more allergy prone, whether it's seasonal allergies, allergies to cats, dogs. They may notice a degree of supplement reactivity, other environmental reactivity like mold, some other symptoms, maybe a running nose, flushing, lightheadedness, depression, insomnia, palpitations, skin reactions, especially hives, looser bowels. These all, to some extent, indicate high levels of histamine. Now, you've probably heard of histamine. If you have allergies, you can take an antihistamine, Claritin, Benadryl, famotidine, loratadine, or natural agents like quercetin, resveratrol, and vitamin C. And what's happening here is when the body is reacting to something with the immune system, an immune reaction, histamine is a mediator of this. This is why antihistamines work to reduce symptoms. However, you can also overeat dietary histamine because there's a variability in histamine content of different foods. Some foods are very rich and high in histamine, and that will flare an immune type gut, whereas other foods are lower in histamine. Have you noticed you don't do well with fermented foods? Or have you also noticed that things like spinach, avocado, canned meats, jerky, or food that's been left in the fridge for a few days tend to flare you? All of these things paint a collective picture that histamine intolerance could be part of the problem. With all of these diets, they tend to be reparative. Any diet that's helpful tends to be reparative. That's also been shown, at least in 2 clinical trials, using a low histamine diet. They've even shown in one of these trials that when undergoing a low histamine diet, you actually produce more of the enzyme that digests histamine, DAO, diamine oxidase. And this is probably because you're allowing the intestinal tract not to have so much of an inflammatory response. Tissues heal, and the tissues in the lining of the intestine are where that DAO enzyme is produced. That's pearl number 1, these 3 gut types: bacterial, pair that with a low FODMAP diet; fungal, pair that with a candida diet or a lower carb diet, does not need to be keto per se; or immune, and pair that with a low histamine diet. Always remembering that you should be able to improve food tolerance over time. Then coming to pearl number 2, and this ties back into my comment about SIBO, and are the bacterial types always SIBO? Maybe not. As more and more research has been published on SIBO breath testing, I've shifted my opinion. I used to be a fan of the lactulose SIBO breath test, and this is what's endorsed by some of the thought leaders in SIBO. However, I have a very hard time of late reconciling that, because as meta-analyses summarizing various clinical trials looking at how accurate a lactulose SIBO breath test is, we are seeing it's not very accurate. Now, how do I mean that? How do we define not very accurate? If you take 100 people, 50 of them have no symptoms, and 50 of them have gas, bloating, loose bowels, abdominal pain, food reactivity, you should see a higher level, significantly so, of SIBO positivity in the symptomatic group and not in the healthy control group. Well, a recent meta-analysis found nearly identical levels of SIBO positivity in healthy controls as compared to symptomatic individuals. All this to say, and come back to the pearl, which is treat symptoms, not labs. Because if the labs are not accurate, if they don't discriminate between healthy people and people with symptoms, then you're treating a somewhat irrelevant marker. Now, another example of this comes from this wonderful meta-analysis, 2023, Frontiers in Immunology. They did not find that the test for leaky gut stool zonulin correlated with improvements. So they tracked a number of clinical trials, pre-post intervention with probiotics, and they tracked, well, after the probiotic intervention, the people who had a noticeable improvement in their symptoms, did that correlate with their stool zonulin improving stool zonulin being a marker for leaky gut? And the answer is no. They did not find that stool zonulin matched how the person felt. They did find that blood or serum zonulin correlated. But all this just to say, we want to be really careful not to treat lab markers first. I would make those secondary. The primary focus is your symptoms. What have you noticed feels good from a dietary perspective? What are your symptoms? What tends to flare you or help you? These data points are the most informative. And then secondary to that, again, you could potentially color slightly how you use supplements or modify your diet based upon the labs. But the lab markers, for most cases, I'm not saying this is an absolute rule, but the lab markers should be secondary and the primary should be you and your response to treatment, because the goal of all this is not to have a good-looking test and feel poorly. It's to feel well. And just one thing I'll add here, because we've had a number of people reach out and ask if we're seeing patients, if I or anyone on our clinical team is. And the answer is yes. I probably don't discuss this enough because we're so sort of ensconced in discussing the research and whatever else. But this is truly at the core of what we do. I absolutely love helping people improve their health in a one-on-one clinical setting. As someone who suffered a decent amount throughout my life with gut issues, I'm so passionate about helping you guys improve. And we are progressively developing. I mean, we're always tweaking and making better, but we have some quantifiable assessments paired with biomarkers or labs to assess bacterial type versus fungal type versus immune type with corresponding dietary interventions and supplement protocols. So if this seems like a lot and you need some guidance, please reach out. Would be more than happy and honored to help you. Again, this really is at the center of what we do. And really, all of this is built upon, in part, my own suffering and then wanting to help alleviate that suffering of other people. So if you need help, reach out to the clinic and we will be more than happy to help. The third pearl is how to supplement smartly. This is a little challenging because supplementation, I think, is best done in a personalized fashion where we have a hypothesis, we give someone a treatment plan, and then we see how they respond and we modify based upon their biofeedback. Nevertheless, I think there's a general approach that can guide you, and always check these things with your healthcare provider first, but 3 layers. First layer, the first few things to consider would be a probiotic supplement, because this supplement, probiotics, will help with the immune type. It's been shown in a number of trials that probiotic supplementation can reduce histamine levels and histamine-mediated symptoms. It can help with fungus. A number of clinical trials have found that probiotics are antifungal, anti-candidal, and can help with SIBO or IBS. So that's an easy one. Glutamine can complement this anywhere between 5 to 15 grams per day, and also an elemental diet used not 2 weeks exclusively. If you go reading on the internet, you may hear it's got to be 2 weeks, so nothing but this sort of medical food meal replacement for 2 weeks. That is overkill. But how you could use it is as a reset. So this liquid meal replacement for a day or 2 or 3, maybe even 4 as a reset. And then from there, maybe replace 1 or 2 meals per day. The elemental diet does use maltodextrin, this easy to absorb carb source. And for those who are wondering if they're a fungal type, and if my claim is that starches and sugars are bad for this type, does that mean if you're a fungal type, you should not use an elemental diet? I don't think that's the case. Now, clinically, I haven't seen that. With any therapy, some people have a negative response. So we always want to factor that in. There have been 2 studies that found either a neutral effect of the elemental diet on intestinal candida or a benefit. And this might be because the elemental diet will absorb within the first 2 or 3 feet of the roughly 22 feet of small intestine. So the majority of the small intestine is able to have a break. The one exception for whom an elemental diet might not be a good fit is people with this sort of oral thrush or upper GI nasopharyngeal candida. And so in these cases, you may notice phlegm, mucus, runny nose, white tongue. And for those individuals, a elemental diet may not be a good fit. The second layer is either use of colostrum or immunoglobulins. Now, these are similar. Colostrum does contain immunoglobulins. A immunoglobulin supplement is just a concentrated version of the immunoglobulins, which are essentially the mucous membrane that coats your intestinal tract and prevents an immune and inflammatory response. The way I've made an analogy for the immunoglobulins is it's akin to taking a shard of glass and dipping that in wax so all the rough edges now can't cut you. That's sort of akin to what immunoglobulins do. They bind specifically to LPS or lipopolysaccharide fragments that can trigger the immune system. The reason why I may have a little bit of a bias toward immunoglobulins over colostrum, although they're both permissible, is the Leonard Weinstock study wherein, and this was in a non-blinded, non-placeboed fashion, so we want to be a little bit cautious, but the setup of this study was interesting in the sense that he gave immunoglobulins to individuals who did not respond to diet, to antibiotics like rifaximin, to antispasmodics, or to laxatives. And he documented an 85, if I'm remembering correctly, 85% response rate. Now, given there was no placebo, we probably want to cut that response rate about in half, but that's still a very favorable response rate. And then the third supplement to consider, and this would really be a number, would be some sort of either direct antimicrobial or antihistamine type support. And we've made this chart. It gets you in the proximity. Many of these natural compounds will be both antibacterial and antifungal at the same time, but this is how I would at least attempt to categorize these. For a bacterial type gut, oregano, peppermint, black walnut, olive leaf, and berberine are considerations. For a fungal type gut, garlic, by the way, one study did find a similar effect on vaginal candida with an antifungal medication as compared to garlic at 500 milligrams dosed 3 times per day. So garlic is one. Artemisinin, or I would say more specifically Artemisia, which is the whole plant. Artemisinin is a isolate, and we'll be doing another follow-up piece on this that's going to be more expansive, but the long short is artemisinin can't be used long-term. There's a tolerance that builds up in the body to this, but, and this is what I love about herbal medicine, when you use the whole plant as Artemisia, that does not happen. And most of the research with wormwood, this is what this is derived from, Artemisia, is done in the model of malaria. It has been demonstrated similar efficacy to clear malaria when using the artemisinin isolate as compared to Artemisia, the whole plant, but the whole plant doesn't lead to this tolerance within the body. Coming back to fungus and candida, it's been shown that Artemisia will, for lack of a better term, sort of sever these filaments or hyphae that chronic candida can create that sort of anchors them into tissue and makes the candida or the fungus more resistant to treatment, which is why I'm progressively becoming a big fan of Artemisia. And also MCT oil. This has been shown in 1 or 2 trials to actually reduce intestinal fungus. It's a derivative of coconut, which is also antifungal. It's just going to be a little bit more concentrated. And then, as I mentioned a moment ago, for the immune types, there's a number of natural antihistamines, quercetin, vitamin C, resveratrol, N-acetylcysteine, and also the immunoglobulins. And then the fourth pearl, do not overlook the importance of lifestyle. This would include time in nature and exercise. Time in nature has been shown very effective in reducing overactivation of centers in the brain that regulate both fear and inflammation, the limbic system, the amygdala or the hippocampus. And some of these studies have been elegant, where They literally put people in a functional MRI, scan their brains, have them take a walk in nature, get back in the functional MRI, rescan, and they show a noticeable drop-off in activation of the amygdala or the hippocampus. And if these centers are overactive, other studies have demonstrated that your blood will be more likely, more inflammatory when it's triggered by LPS, one of the particles that leaks through in leaky gut. And exercise, probably no need to convince you of this, but it has been demonstrated to improve the health of the gut bacteria, the microbiota diversity, and also to reduce leaky gut. There is one caveat that if you're consistently exercising for over an hour, this is when you can actually worsen leaky gut. So like many things in biology, there's a sweet spot, and we want to aim for 60 minutes or less, I think 3 to 5 days per week, with a split of weights or resistance and cardio is a good aim. And then in close, I wanted to paraphrase Solomon, a good question contains half the answer. In a way, I want to commend you for what I think you're doing, which is asking an intelligent question. How could treatment of leaky gut improve my health? And whether that health issue is brain fog, insomnia, joint pain, skin issues, loose bowels, bloating, abdominal pain, the question of how leaky gut pertains to that does seem to contain half of the answer. Instead of looking up, well, what's a natural supplement for brain fog, let's say, which can be fine and good, something like acetyl L-carnitine, no problem with that. However, it's not really treating the underlying cause of brain fog if that's coming from your gut. And knowing that 40% of the population has some sort of functional gastrointestinal disorder, it makes a lot of sense to start with your gut. So there's a few clinical pearls. I hope this helps, and I hope you'll comment and let me know either how it goes or what you think. All right, this is Dr. Ruscio, and I'll talk to you next time.